am a neonatologist at a regional transfer center, and we routinely get critically ill babies as transports from smaller institutions that are not well equipped to care for these babies in the long term. And the first hour after birth is called the golden hour, so interventions that are done or not done during this time can greatly impact the outcome of these babies. We wanted to increase not only the skill but also the confidence of the caregivers at these smaller institutions, so they felt better equipped to care for these babies in the short term before the transport center came to bring them to our hospital. We created a multidisciplinary team led by myself as the neonatologist, a neonatal nurse practitioner, a nurse and respiratory therapist, along with a simulation expert and a neonatal mannequin. And we traveled to these different smaller institutions in our area, and we reviewed protocols and taught education surrounding the golden hour so they could feel more confident with the care of these babies before we got there. We encouraged them to treat the mannequin as if it were a real baby, and we used their own resources and their own environment so they could also identify and remediate latent safety threats in the environment. For example, moving an emergency code box closer to the infant warmer so it'd be more easily accessible in the time of need. We recreated common high-risk infant scenarios such as meconium aspiration or the extremely preterm infant, among other ones. We really could tailor the education to what each institution requested. If they were receiving a lot of smaller babies, for instance, we could focus primarily on that. If they had certain needs, we would tailor the scenarios to meet those needs. We have trained almost 250 people so far in the training in various institutions. We've gone to about 6 different institutions in our area and trained the staff. Okay. The participants all reported an increase in their confidence and the ability to stabilize these babies prior to transfer. Simulation is a great educational tool. It allows us to recreate low frequency but high risk scenarios, and it allowed them to really feel comfortable with what they needed to do before our team got there.